Sorry I kept you waiting. Busy day. We're looking after you?
Yes. Thank you.
Have you been sore?
A little sore, yeah.
Oh, yeah, that feels fine. Let's just get those staples out.
Doctor, my husband, he's a good man, and I think he's a little nervous. Will the scar always be so?
Tell your husband you look like a Playboy centerfold. You have the staple marks to prove it.
Dr. McKee, what is it?
Give him a minute.
You see for yourself, I'm in a waiting room.
One fewer.
What?
You have one fewer patient. I'm out.
Look, doctor, I'm not hanging up.
That's the problem. You don't have the first idea of what I'm seeing. I think you're letting brush up your act, Dr. Rabbit. Because today I'm sick. Tomorrow or the day after, 3 years from now, you'll be sick. Every doctor becomes a patient somewhere down the line, and then it'll hit you harder than it's hit me.
I'm finding it very offensive. If you don't mind.
Sure. If I had a patient like me when I was a doctor like you, I'll just wait for my file.
I'll get you your button.
Airmail. Thank you.
Here we have a juvenile onset diabetic with poor circulation and diabetic neuropathy. As you can see, these are diabetic ulcers with lymphedema and evidence of gangrene. Questions? Any osteomyelitis? None apparent, although not definitive. Treatment? To stabilize the blood sugar. Consider antibiotics, possibly amputation. What's their name? I was just wondering the patient's name. Marjorie. Hi, Marjorie. Hi. Yes, thank you. Let's move on. What's wrong with death, sir? What are we so mortally afraid of? Why can't we treat death with a certain amount of humanity and dignity and decency and, God forbid, maybe even humor? Death is not the enemy, gentlemen. If we're going to fight a disease, let's fight one of the most terrible diseases of all, indifference. Now I've sat in your schools and heard people lecture on transference and professional distance. Transference is inevitable, sir. Every human being has an impact on another. Why don't we want that in a patient-doctor relationship? That's why I've listened to your teachings and I believe they're wrong. A doctor's mission should be not just to prevent death, but also to improve the quality of life. That's why you treat a disease, you win, you lose. You treat a person, I guarantee you'll win, no matter what the outcome.